Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Forehead lift. Introduction. A forehead lift or brow lift is a surgical procedure. It raises the eyebrows and eyelids to improve appearance and make patients look more youthful. This program explains forehead lifts. It discusses the procedure, risks, and results. Anatomy and aging. Our face is the first thing people see and notice. It shows our expressions, feelings, and personality. Skin covers the whole body. Young skin is elastic and tight. Natural aging causes changes in the skin. The skin starts to wrinkle, lose its elasticity, and become looser against the bones. Muscles also tend to become less tight with age. Smoking and exposure to the sun speed up the changes in the skin as we age. These changes lead to wrinkles that form in the forehead, around the eyes, around the mouth, and in the cheeks. Women's faces begin to change at an earlier age than men's. This is because women's skin is thinner and does not have as much blood supply. Changes usually start in the early 40s for women and the late 40s for men. Skin will sag around the eyes, cheeks, and neck. Wrinkles will appear shallow at first and then deeper. Sagging skin around the eyes can lead to puffiness, which sometimes makes it hard to see. Facial cosmetic surgery. Cosmetic surgery can improve a person's appearance. The decision to have cosmetic surgery is reached by you and your healthcare provider together. Good communication is important to make an educated decision. The healthcare provider needs to evaluate your general health and find out what you expect from facial surgery. He or she will then examine your face and recommend one or more specific facial cosmetic procedures. You should have realistic expectations about what cosmetic surgery can do for you. You should also understand the possible risks and complications, as well as the cost of the surgery.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Forehead lift. A forehead lift can raise the eyebrows and eyelids by tightening loose muscles and skin. This can reduce wrinkles to make the person look younger and more rested. A forehead lift is sometimes done at the same time as other cosmetic surgeries. These may include a facelift to improve the appearance of the cheeks or jawline. The surgeon may perform the procedure in their office or in a healthcare facility. A brow lift will not diminish crow's feet. Though it can affect drooping eyelids, it will not affect eyelid puffiness or bulging. Some wrinkles are likely to return later in people who have expressive faces. The procedure. 3 surgical procedures can be used for a forehead lift. Coronal brow lift, hairline brow lift, endoscopic brow lift. These options have different benefits and drawbacks. Your surgeon will help you choose the best option for you. During a coronal brow lift, the surgeon makes an incision along the top of the head in the hair itself and lifts the forehead, removing any extra skin. Your surgeon can change the muscles that cause forehead wrinkles through this incision. The procedure usually takes about an hour. Nerves at the top of the head are affected because the surgery involves cutting through skin and muscle. As a result, temporary itching or numbness is common after the procedure. A hairline brow lift is another type of forehead lift that uses an incision at the hairline or at the top of the forehead. It may be a good option for those with a high forehead or receding hairline. With a hairline brow lift, the forehead isn't being pulled up like it is with a coronal brow lift. The procedure usually takes about an hour. The hairline brow lift can improve horizontal wrinkles, but it may leave a scar at the hairline depending on how the incision heals. This type of forehead lift works best for people who wear bangs. An endoscopic brow lift is another type of forehead lift. It uses an endoscope, which is a thin tube with a camera and light attached. The procedure usually takes about an hour. The surgeon makes 4 to 6 small incisions behind the hairline. The endoscope goes through the incisions. It guides the surgeon as he or she removes the muscle that cause frown lines. After removing some of the muscle, the surgeon shifts the skin backward on the head. This moves the eyebrows to a higher level. During the forehead lift, you may be awake. Local anesthesia and medicine will help you relax and not feel pain. You may feel a pulling sensation or some discomfort. Sometimes the surgeon will use general anesthesia instead, so you will not be awake during the procedure. The surgeon may need to trim a small amount of hair around the incision. They will then remove extra skin and muscle as needed. The incision may be closed with staples or stitches and wrapped in dressings. Screws may be used to keep the skin in place while it heals. Risks. A forehead lift may cause problems after surgery. These include problems related to anesthesia, bleeding, infection, swelling, and bruising for several weeks. Certain medical conditions could cause problems during or after surgery. These include blood clotting problems, tendency to form excessive scars, uncontrolled high blood pressure. Coronal brow lifts often cause temporary or permanent numbness on top of the scalp. This numbness is usually not a problem with endoscopic lifts. Paralysis of the forehead caused by nerve damage happens in less than 1% of patients. If the skin is too tight or swollen after surgery, the scar may be large. Hair at the scar line will not grow back. Most people can hide this with bangs. Not all patients are good candidates for surgery. Those who have had an eyelid lift in the past may have trouble closing their eyes after a forehead lift. Patients may have trouble using the muscles of the forehead following surgery. If facial expressions are uneven, another surgery may be needed. Most people are satisfied with the outcome of surgery once they are completely healed. After the procedure, you will have dressings around your head to manage swelling and keep the incision from bleeding. Your healthcare provider will remove the dressings within a couple of days. You should sit up instead of laying down as much as possible to reduce swelling. You may have bruising around the face after surgery. Your forehead and the top of your head may feel numb, followed by some itching and tingling as the nerves heal. Medication can help with any soreness or numbness you may feel. Your healthcare provider will remove the stitches or staples after 1 or 2 weeks. Ask your healthcare provider when you can shower and return to work. You will need to avoid strenuous activities, hot weather, and sun exposure after surgery. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Our face is the first thing people see and notice. It shows our expressions, feelings, and personality. A forehead lift or brow lift is a surgical procedure. It raises the eyebrows and eyelids to improve appearance and make patients look more youthful. 3 surgical procedures can be used for a forehead lift: coronal brow lift, hairline brow lift, endoscopic brow lift. These options have different benefits and drawbacks. Your surgeon will help you choose the best option for you. During the forehead lift, you may be awake. Local anesthesia and medicine will help you relax and not feel pain. You may feel a pulling sensation or some discomfort. Sometimes the surgeon will use general anesthesia instead, so you will not be awake during the procedure. You may have bruising around the face after surgery. Your forehead and top of the head may feel numb, followed by some itching and tingling as the nerves heal. Medication can help with any soreness or numbness you may feel. Most people are satisfied with the outcome of surgery once they are completely healed.
Thank you for using Explain.